Well, good afternoon. Thank you for joining us this afternoon in this segment. Today, we're very fortunate to have Mr. Kabir Karim from the American Lung Association joining us and giving us very valuable information. And we're just very fortunate that we're able to do it. We've talked about using different platforms now with this COVID-19 new norm, and I think this is one of them. Mr. Karim, we welcome you. Thank you so much for your time this afternoon. And so tell us a little bit about your position and what is it that you do with the American Lung Association. And of course, American Lung Association, which has been in existence for quite some time and really making a huge impact in the community. Thank you for being here.
Yeah, thank you for having me. Let me give you an introduction to the American Lung Association first. We are, believe it or not, one of the oldest public health organizations in America. We kind of burst into the scene in the early 1900s, so over 100 years ago, and we were tackling the tuberculosis epidemic at the time. And then after that, we just evolved into one after another health issue, another lung health issue, until finally we just became pretty much the champions of lung health here in America. And simply put, our mission is to prevent lung disease and to improve the lives of people who already have lung disease. And we do that through our efforts in education, advocacy, and research. And my position here as a health specialist for Texas region is basically I'm the guy involved with all programs related to tobacco, lung cancer, and better breathers clubs for people who have lung disease.
Correctly. And yeah, like you said, it's been an organization that has been making an impact in society for more than a decade already. And I think we hear it often, but a lot of people don't know or only associate American Lung Association with lung cancer, right? And I'm sure there are so many other things that you all do, and you talk about research, right? And so can you tell us a little bit of the research and what other things are we talking about? I know that maybe back in the 80s, tuberculosis was a big thing, at least here in Brownsville. I remember because I had a family member who had to go through so many exams and everything. This is something that was going on during that time. And but I'm sure that the American Lung Association deals with many other things.
Yeah, that's right. I mean, we have many members in our work colleagues have had some kind of relationship with lung disease. Either they had a family member die of lung cancer, or they had a family member have tuberculosis. Myself, I had family members who died of lung cancer. My father-in-law had idiopathic pulmonary fibrosis and had to have a lung transplant. But we are pretty wide scoping now. Our five main strategic priorities are to defeat lung cancer and to be championing clean air for all, improve the quality of life for those who already have lung disease, and create a tobacco vape-free future. And one we just added onto our strategic plan was improving for future, or preparing, sorry, for future flu pandemics. So we have a couple of signature programs in education and advocacy and research. And just to give you just a couple of them that I think are most relevant to your listeners, I would like to first begin with our Better Breathers Club, which is basically our support groups for those who are living with lung disease. So if you are interested, you can join a club. There's several dotted around Texas. I believe there's one in Brownsville. I believe there is one. If not, we have to start one up.
Right.
We also have our Freedom from Smoking program, which is our signature smoking cessation program for adults. And similarly, we have our Not on Tobacco program, which is our youth cessation program that's recently we've revamped it to include much of the vaping issues today. So that will be ready to launch this fall. And we also have our smoke-free housing initiative. Of course, we have the new HUD rule that was passed a couple of years ago to make all federal public housing smoke-free, and we were one of the, I think, main stakeholders to pass that law. And I've been working with public housing to help them through their smoke-free journey to make their facilities more friendly to their residents, given that it's very difficult, of course, to suddenly know that your building is, or your resident is going to be smoke-free, and you yourself are a smoker. So we try to help give some technical assistance to help with that. And in general, to help multi-unit housing go smoke-free. So I am working with some local initiatives to hopefully start something up here, and at least starting with Dallas, and maybe have some kind of relationship to help all multi-unit housing, whether private or public, to be smoke-free. We also have our more advocacy type interventions, such as our Saved by the Scan campaign, just reminding people that if you're between 55 and 80 years old and have smoked a pack a day for 30 years or equivalent, and are a current smoker or have quit within the last 15 years, then you are at high risk of perhaps having lung cancer, and you should have a scan immediately to see if you have lung cancer, because the symptoms for lung cancer usually come in stage 3, the last stage of the disease, and by then it's too late to really do much. So it's very important that people do their scans if they are at high risk. So we try to campaign for that. Also, our national lung helpline at 1-800-LUNG-USA, and we also have our fundraising campaigns, the Lung Force Walk that we do every year for lung cancer research, and our Fight for Air Climb also. We do that every year, at least one in Dallas and one in Houston. Of course, with COVID-19, some of these have been disrupted, but we do our best to do that. And in terms of research, there are a few, I mean, we fund research in all different levels, but I think the very two things that we have done recently is our funding for one of our colleagues. He's found the key protein in COVID-19 that will be hopefully be just one step closer to hopefully producing a vaccine one day.
Wonderful.
So our funded research, he found that, and actually that was here in Texas as well. And also we have another a research funded research campaign. It's a very long research study that will be conducted over a number of years. It'll be a cohort following the lifestyles of many different individuals, and seeing which is the best factors that can help with helping with lung cancer and other lung diseases. So that's a first of its kind, and it's going to, I think, be a game changer in terms of our fight for lung disease.
Wonderful. Well, we know that American Lung Association is on top of the game. You know, we're glad to hear these news.
We're trying our best, yeah.
Yes, I mean, there's just so many things going on, right? And just being able to say, you know, we're doing research and we're trying to get the help, right, that is needed. It's wonderful to know. So just to let you know that the initiative and these housing authority, the city of Brownsville, has begun the initiative of smoke-free units. So those are things that we started, as you know, we've last met with one of the presentations that you given. So that's something that we are working with our residents. You also mentioned 1-800-LUNG-USA. So this is a phone number that is available for the community to call. And we're wondering, what kind of questions can we ask there? Is it just for referrals, or is it just specific things that are dealt with when you make that phone call?
Pretty much any question you have related to lung disease, you can call that number. Pretty much any question. Referrals is a little bit will be a little bit difficult. Usually, those kinds of things are then referred to me, and then I will give the referral. But in general, yeah, any question on lung disease, any question on how to quit your smoking habits or vaping habits. So in much the same way, it's pretty similar to the state quit line, but with some slight differences. One of them being you can just call as many times you want. And it's not even an issue. We don't give out free medication or anything like that, like the quit line does. But our people there working there, the difference is they're all healthcare professionals with a professional degree, usually in pulmonology or in that department. They're very specialized in lung health. So that's kind of one of the unique things about our helpline. Any question on COVID-19, you can ask them. Anything related to American Lung, any of our programs, people want trainings from us, they usually call the helpline first, and it's then the question refers to me and I can answer them. So anything like that. And if you want to volunteer, that's probably the best way to go through is give your information to the helpline and we'll contact you.
Wonderful, wonderful. One question that we had, and we're wondering if you can answer for us. Are there any threats in the quality of the current air? And if so, what are they?
Yeah, so every year we do a state of the air report, and you can even Google it, and it's in PDF form. Our publication this year for 2020, I mean, just looking at the data last year, but in general, the trends are not looking good. Overall, most of our air is getting worse. There are some cities that are doing a better job. Sometimes out of no intervention of their own, maybe it was the weather or something like that, that would mean that the pollution is a little less, more rain that year or something like that. I think it's a pertinent question for Brownsville, especially because you're ranked, I think, the 25th worst city in America for pollution. Not as bad as some other places in Texas. Not as bad as Houston. Not as bad as McAllen, your neighbors there. So you're not the worst, but and in fact for ozone pollution, you're actually one of the best in the nation.
Good.
But yeah, in general, the trend is that things are not getting worse and things aren't getting better. I mean, we're not Mexico City bad at this point, but I mean, that's one of the most polluted cities in the world. But in general, I would say the trend isn't looking particularly good, and even especially Brownsville, you're up there. But just as much as outdoor pollutants are something to be, especially if you have lung disease or some kind of asthma or something like that. Indoor pollutants are just as bad. On top of that list, at the time at least, was secondhand smoke, and that's why we were one of the major stakeholders and backers of this new HUD rule, was because secondhand smoke kills over 42,000 people a year, and most of that happens inside the house, and especially susceptible was multi-unit public housing, where you're all together, you're scrunched up, the smoke goes through the walls, goes to the sockets, goes to the neighbors, goes to the corridors. So it was really important that we felt that it was that law was passed, and it was just kind of cleaning up the complicated issues after that needed to be taken care of. And but yeah, in general, we should keep in mind that whilst outdoor it's bad, indoor is where we spend a lot of half our day, if not more, especially now with COVID-19. And we should really try to not be to be smoking most of all in our residence.
Right, right. And you may point to vaping. Is that how you say vaping? Vaping. Yes. And we see a lot of young people not taking the seriousness of the harm, that they're causing other bodies. Is it worse to do that or to smoke?
Okay, this is a it's not, you may think it's a simple question, but it's not a straightforward answer. And actually, really, it's not even the right question to ask, because really our air is, we have a right to clean air. We have a right to be breathing and clean air, and we have really to protect our children. And the tobacco industry is there to exploit our youth. We've known for decades that's the case from internal documents, and this is kind of what they do. And the electronic cigarette, or it's just another evolution of the tobacco product to hook people on nicotine, and the younger they can hook them, the better. And this is just a long line of the same old message, really. So it's just such a bigger issue. If it was to say, if we converted to just vaping and not do any cigarette tobacco smoking, technically speaking, you could say it's on balance better, but it's just so much more complicated in that the amount of especially the amount of nicotine that's in a lot of these vaping devices, they're really far too high. And now you've got these pods where you can kind of customize, so even the kids themselves can put even more nicotine in those products. You also have you also have the fact that vaping is, sorry, I'm losing my train of thought here for a second. Yes, you also have the complicacy of poverty as well. So cigarettes are still cheaper than electronic cigarettes and vaping, and so it tends to be a gateway drug to cigarettes, which are cheaper and give you a quicker and more powerful hit as well of nicotine still. So it's an allure to just go on to just transition over to cigarettes, and that's tending what we would to see in the data. We see that. So it's, I hope that answers the question. It's not a simple answer. It's a very
I realize it's not a simple question, but and I've heard it because we have friends and we talk, and it's always the answer from a young person that might be vaping. It's not as bad as smoking. That's usually some of the answers. When you're trying to encourage them not to. The answer is usually what's not as bad as smoking. So just kind of throwing it out there so that people realize that it is going into your system, it's going to your lungs, right? And even will have some impact.
I would definitely check out our website. That gives you more information, especially if you're a parent wants to talk to your child about this. You can go to lung.org / the vape talk, and you can get like a downloadable PDF how to strike a conversation with your child about vaping, and some of it gives you information about it too. So I would definitely check that out.
Yes, well, thank you so much for that information. So you talked also about calling the 1-800-LUNG USA if anyone was interested in volunteering or being involved with the American Lung Association. And you also talked about the webpage, which we'll have available in this broadcast. So anything else that you would like to share with us today? And we're very, very fortunate that you've taken this time and giving us this valuable information.
Well, thank you for having me again and letting me voice our our mission and our goals here at American Lung Association, just check out our website, www.lung.org. And we have in Texas our virtual Lung Force Walk coming up in August. But other than that, yeah, just if you need to contact me, I'm also here and available.
Well, thank you so much. Well, thank you so much for this afternoon. It was wonderful to talk to you. And of course, this would be hopefully the first of many. And I know that we ourselves are committed and we want to be involved and help with all the initiatives at the American Lung Association. Thank you very much. Thank you.
All right.
Now, can we go back?
Yes, sir.